Hi, so for this week's discussion post, we're asked to reflect on our previous SEL coursework and what tools we will bring from our previous coursework that will help us feel more comfortable when conversing with outpatient clients. Um, so, when reflecting back on my previous community SEL work that I've done, I found that when I was doing my community settings that I got a lot of practice of speaking with various types of patients and individuals, whether it was the patients themselves or other staff members or just people coming with their family members. My community outpatient setting this year is at a bariatric center. It's part of my clinical hospital, but it's an outpatient bariatric setting, and I work with a dietitian there. And there's other staff members, doctors, nurses, etc., that help with the process. But through this SEL setting, I've been able to practice speaking with different types of patients. This community in general, I work within Perth Amboy, New Jersey, which is a high Spanish population. So a lot of these patients either don't speak English, they come from low income families. So sometimes when we educate these patients on the certain type of vitamins or protein powders that they need to be taking with the bariatric surgery, we try to give them more affordable options. We try to explain things both in English and Spanish, depending on, any language barriers. We try to slow down and explain things in simpler terms so the patients can actually grasp the information and understand what we're saying to them. So I think through this experience, I've got a lot of experience with outpatient, talking to clients, interviewing them, trying to, understand how to make things better and simpler for the patient process. Some weaknesses I do think can come up for me still is getting lost in what I want to say. Sometimes, depending on the answer that a patient might say back to me, I might get a little stumbled, and I have to practice like taking a moment to just pause, rethink what I want to say. It's okay that if I don't know what to say right away or if I'm not sure about something, just come back to it or take a second to just collect my thoughts in order to, assure I am helping the patient in the right way. So, those are my thoughts for this week's discussion.